My name is Pamela Yount. I'm a certified medical assistant for Kootenai Clinic Cancer Services and Kootenai Clinic Palliative Care. A medical assistant is, I like to refer to a jack of all trades for the medical field. It's someone that has a broad scope and can do multiple things, and you get one education but have multiple avenues to choose from when you graduate. Here at Kootenai Health, I room patients for the doctors. I work in the infusion center for the cancer center and room patients in there, and we are another touch point for those patients as they come in. They meet with the nurse, they meet with the doctor, and we get to see them briefly and just get them ready for those folks. When we get a patient ready, typically they're checked in through the electronic medical record, and we will call them back, get their vitals, their blood pressure, their height, their weight, go over their medications, make sure they're taking everything correctly, and add anything, change anything that needs to be removed. We will see what their complaints are for that day, maybe not necessarily what they're being seen for overall, but what are they feeling like today? And what are some symptoms that they might have that we need to address. We will get them seen by the doctor prior to their chemotherapy. I've been here for 9 years at Kootenai Clinic Cancer Services. I got a job here right after graduating, and I was 20 years old, so it was my first job, and I've been here ever since. And I was really grateful that they took a chance on me because I had no experience, and they really took a chance on me, and I'm grateful for that. For me personally, my family had a lot of medical issues, so I grew up going to doctor's offices, and it was, I saw those people helping and just taking such good care of my family, and that's kind of what inspired me to choose medical assisting. After I graduated high school, I was looking at whether I should become a CNA or a medical assistant, and I was able to reach out to job services, who kind of gave me some counsel at 19, not really sure what I want to do with life and that kind of thing, and they were able to explain how the program works at a local college called Apollo College at the time. And they have an accelerated program that's a 10-month program. And so the idea that I could be working in less than a year with the education I received was something that really motivated me to go ahead and move forward with that. With medical assisting, the training that you get is focused. As I said, it's an accelerated program typically, and they train you for phlebotomy, EKGs, they train you for front office and back office. Front office meaning clerical work, back office meaning clinical work, where you're rooming the patients, taking their blood pressure, and the front office is the clerical aspect where you might be checking patients in, scheduling them for appointments, doing some chart prep for the patients that are being seen the next day. I think some important characteristics of somebody that is choosing medical assisting: you need to be a people person. You're dealing with a variety of patients. Here we serve an elderly demographic, and just knowing how to deal with that and communicating with them. Obviously, a lot of our patients are hard of hearing, and wanting to be respectful of those kind of situations. And I think you do have to have some computer skills, not necessarily be great with technology, but do have to have some basic computer skills. Thankfully, Kootenai Health has a great IT support.